Hello friends, I'm Dr. PINTU KANANI. I'm a consultant homeopath practicing homeopathy in Baroda, India since 22 years. So today we are going to discuss about role of homeopathy in insomnia or in sleeplessness. Now, as you know, as in insomnia, it's trouble in falling asleep or staying asleep. So there is certain normal durations of hours that we should have sleep. If we don't have that relatively good qualitative sleep, it also can turn into the insomnia. Now it can be a short term. Sometimes in certain people it stays for a couple of weeks or more, and if it turn out to be a chronic, so in certain patient it remains for a longer duration of time as well. So let's discuss what are the basic causes for that. Basic is stress, trauma, anxiety. Then certain biological clock we all, every human being is having, is being set. If it get disturbed, then people suffer from sleeplessness or insomnia, like those having a duty in a shift, or if somebody is having a condition like sleep apnea. Then certain environmental noises, that you are in a surrounding where its situation is not that cozy, that makes you not have a comfortable sleep. And then if you are moving into a high altitude, then there is sometimes might be difficulty in having a good sleep. Then there are certain psychological issues like depression, bipolar disorder, psychotic disorder, anxiety disorder, certain hormonal shift, especially during the menopause and occasionally during the menstruation as well. People have this sleeplessness or insomnia. Or an individual is suffering from a chronic pain, they are most likely to have insomnia. Other factors are snoring, overactive mind. Sometimes, we have overactive mind, might be due to many reasons, like if you are habituated to stimuli and if you are taking addicted to stimuli, so that is also one of reason. Or otherwise also, if you are having too much of an overactive mind, it can turn out to be a this condition. Then pregnancy is sometimes certain amount of females have a loss of sleep or kind of an insomnia during pregnancy. Other conditions that can result in this is ADHD, then pain, uh, heart failure or certain conditions which is related to the heart, hypothyroidism, heartburn, especially what we call is a gastritis, heartburn, where you have burning in the stomach and into your esophageal region, which can lead you to having a loss of sleep. Then restless leg syndrome. Certain people are having a restless, especially at night, then they are not going to have a very thorough or sound sleep. Then certain medications can lead to the insomnia, as well as certain substance abuse, like caffeine, nicotine, opiates. So those who are addicted, alcoholism, they can also suffer from this condition. Now, if you generally see the symptom is that one is as the name suggests, it's like difficulty in falling asleep. Then you have frequent disturbance in sleep, so you are waking up frequently couple of time and you are not having good sleep because it takes time for you to have a sleep after you wake up. Then due to that you will have a loss of focus, you are not able to focus in your daily activity or in your professional life. Then due to this insomnia and continuous, when it's remain for a couple of weeks or more, or if it is becoming a chronic condition, then you become irritable, agitated, becoming more aggressive and impulsive. Now there are certain tips that we can have. It first is to avoid this. First and foremost thing in today's modern world is that avoids any gadgets, anything, like whether it's a mobile, laptop, your iPad or anything, in your bedroom at your sleeping time. Don't indulge into all that thing. Avoid large meal, especially when you are expecting to go to bed. Then maintain your regular exercise. Regular exercise is also one of the phenomena that help you to have, your mind and body balance. Not just regular exercise help your physical body, but also help you to have that balance, and that also help you to have a good sleep, because it gives you some kind of an lethargy as well, some kind of exhaustion as well, so which will lead you to the good sleep as well. Then try a relaxing activity before sleep. So listen to good music, soothing music, meditative music, and not the music which is very fast or something which again stimulate your a lot of thoughts, a lot of emotions. So make sure that you have a relaxing activity before sleep. So don't indulge into the mobile phone, laptop, or any activity, or TV serials, anything that can take a lot of time. At least have 15 minutes, half an hour gap. You have it before you go to sleep. So you stop all this activity at least 20 to 30 minutes prior to going to your sleep so that you can have a good sleep. Now then comes to what homeopathy can play a role in this. So one is, as I told you, isn't it, a constitutional remedy. If that becomes a chronic condition for you, it's not just an acute that you are suffering for a couple of weeks, 7 days, 10 days, but if it has become since a longer period of time, since a couple of months, 30 days, 45 days, or even more, that that you are not having a good sleep, it means that there is something going inside you. We need to understand. So their approach should be the constitutional remedy, wherein not just take your physical, if you have any other physical ailments, as I told you that there are certain physical ailments which are responsible for having insomnia. Then other psychological conditions which we also discuss, whether it's anxiety disorder, psychotic disorder, stress, depression, whatever it may be. So that also we are going to take into account your physical symptom, your emotional aspect, your life space, your hobbies, your desire, your aversions. On that basis, we understand your personality type, and according to that, we'll select the constitutional remedy which help you to get rid of that condition. And due to that, you're suffering from insomnia, so you can get rid of that. Now, if it is a very acute phenomena, then you have to see if something acutely has come up, whether it's an acute condition which has created some pain or discomfort, and due to that you are not having any sleep, or certain situation has suddenly arise and you are not able to focus, you are not having a good sleep. So we have to take an acute condition into account and then to prescribe the medicine accordingly. Now, other aspect is a palliative approaches, especially into the old patient. I'm using especially those who are into, sometimes you will meet the people who are into their 70s, late 70s or early 80s or even late 60s. They suffer from chronic insomnia. So first approach should be constitutional medicine. But if they are suffering from an chronic ailments which are kind of an incurable, or they suffer from any degenerative disorder or any other conditions, whether it's related to the mind or body in any way, there we can have a palliative mode of approach, like very old patients who are into their 80s and it's difficult for them to have a good sleep because of a lot of ailments naturally during that time, their body withered out, their a lot of memory issues and other issues are also sometimes related to with that. So that time you can take uh, palliative approach, like sleeplessness in old people. So there are certain group of remedies like aconite, arsenic, verita, opium, passiflora, phosphorus, cephalinum, sulfur. I'm just giving you the certain names. This is not necessary that you give to this group of people. I'm just giving you as an example that this remedy could be thought of. And like as I told you, if any acute condition, or if even if like something with suddenly which is acutely happening, like activity sleeplessness with, like sometimes it happens. Okay, we have insomnia for a short period of time or sometimes for a couple of weeks. So then certain group of remedy like thea, digitalis, rustox, zinc. See, I'm here suggesting you the list of remedy and just giving you just two an example or two rubrics, is that it gives you an idea that in homeopathy we have very precise remedy available for these symptoms. So we'll not just pick up a one symptom, we'll have a large number of the symptom, we'll have an evaluation, and out of that we zero down to the remedy, which is covering the most symptom, or which is, you know, resonate with your personality type. That medicine will heal your conditions. But I told you, isn't it, like in palliative conditions, passiflora is one of a remedy where, especially into the old age, or especially the children's and old age, especially people with convulsions or people with a lot of other disorders, they have difficulty in having sleep. This is one of remedy to be thought of. So that is what homeopathy can play a role, a constitutional approach. If it is in very acute, then look for an acute remedy, what can help you out. Or if you are into ailing conditions, withered out constitutions, a very old age with a lot of ailments, then you can opt for a palliative approach as well. Now, another thing which is very, very important here is a therapy. Therapy in a sense that when you go for sleep, as I told you, first is that avoid gadgets, avoids all other noises and other stimuli, avoid large meal, have good atmosphere, good soothing music if possible, and you can also opt for a therapy like progressive relaxations, basics as simple as this, which we can, everybody can do it at home. In a progressive relaxations, you just observe your breath, and with each breath you feel each and every part of your body is getting more and more relaxed. So with this progressive relaxation, in a 15-20 minutes, you feel you will be into a rhythmic pattern of your breathing, your body will get relaxed, and slowly and gradually you can go into a deeper sleep. So that way this can also help you. So friends, this is it for